An introduction to laparoscopic or minimal access surgery. This video has been presented in order to dispel myths, misunderstandings, and ignorance about laparoscopic or minimal access surgery and educate people in general about what laparoscopic surgery is all about. What is laparoscopy? It is also known as minimal access or keyhole surgery or scarless surgery. It is performed for abdominal or thoracic organs mainly and is not the same as laser. Most people have a feeling that laser and laparoscopic surgery are the same, but it is not. It is basically a surgery or a surgical procedure which is carried out inside the body by introducing specially designed long, slim instruments through special entry ports. The small instruments that you can see in contact with the skin of the patient's abdomen are entry ports through which long hand instruments and a telescope are introduced. The telescope is attached to a camera and the surgeon views the insides of the patient and performs the operation while looking at a TV monitor to which the camera unit is connected. The first laparoscopic appendectomy was performed in 1983, and the first laparoscopic gallbladder removal surgery was performed in the world in 1986. The first video laparoscopic cholecystectomy was performed in 1987, but it was in 1990 that Dr. Tempton Udvadia performed India's first laparoscopic cholecystectomy, that is gallbladder removal surgery, at Sir J.J. Hospital in Mumbai. Laparoscopic instruments have undergone an evolution from these type of preliminary instruments in those days to the present status. Dr. Tempton Udvadia is one of the most respected senior surgeons practicing even today. This is what a modern laparoscopy unit looks like. It consists of a high definition camera system attached to a high definition monitor for display and visualization of surgery. It includes a carbon dioxide insufflator, that is the gas that needs to be introduced inside the abdominal cavity in order to create an inert space for visualization of organs while performing the surgery. The unit also includes various energy devices, electrocautery system, and a harmonic scalpel, that is an ultrasonic scalpel, and various other types of energy devices. So, what are the surgeries that can be performed by laparoscopy? It includes surgery for all abdominal pathologies, including the organs in the peritoneal and retroperitoneal spaces, including cancers and non-cancerous conditions. Basic laparoscopic surgery include mainly those for treatment of appendix and gallbladder diseases, whereas advanced laparoscopy includes surgery for intestine, large and small, malignancy, spleen, liver, pancreas, stomach, all types of hernias, and those for gastroesophageal reflux disease. Weight loss or bariatric surgery is also laparoscopically done. Thoracoscopy, that is surgery in the chest cavity on the esophagus, lungs, lung partial resections, empyema thoracis, thymus, and thoracoscopic biopsies are also minimally invasive surgeries. Gynecological procedures are routinely carried out, such as hysterectomy, sterilization, myomectomy, ovarian tumors, cysts, or ectopic pregnancy. Minimal access surgery has a lot of advantages over open surgery, mainly in the form of smaller scars, as you can see in the comparison in these two pictures. Laparoscopic surgery means a short hospital stay, early return to work and to normal life, and also less risk of wound infection. Whatever complications are described for laparoscopic surgery are all similar to those of open surgery. In order to prevent complications, proper patient selection for a particular procedure has to be done very well. The surgeon's expertise and experience has to be taken into consideration, and proper technological backup is extremely important in laparoscopic surgery. Misunderstandings or myths about laparoscopic surgery, such as a high recurrence of symptoms or higher rate of complications or failure of laparoscopy, are all just plain misunderstandings. I must emphasize that the procedure which is performed inside the chest or abdominal cavity is the same, whether it may be done by introducing the surgeon's hands inside the patient in an open surgery or introduction of instruments inside the patient in laparoscopic surgery. Also, the cost between laparoscopic, and open surgery is comparable. The advantages are thus many as compared to the disadvantages. As we have already discussed, the laparoscopy equipment consists of the optics, the insufflator, entry ports, operating instruments, energy devices such as electrocautery, ultrasonic, scalpel, various dissecting and cutting devices, organ cutting instruments such as the morcellator, stapling devices, implants, suction irrigation systems, and anesthesia. This picture denotes the latest and recent developments in laparoscopic surgery, which include a 3D laparoscopy, robotic surgery in laparoscopy, single incision laparoscopic surgery. Natural orifice transluminal endoscopic surgery is also on the horizon and is practiced routinely in some centers, which includes endoscopic removal of organs through the mouth or through the anus or through the vagina in females. The future of laparoscopic surgery has no bounds. With developments in biomedical engineering, such as robotics in medicine, artificial intelligence, nanotechnology, nuclear imaging, various advances in the fields of optics, imaging, and display are going to advance laparoscopic surgery to greater and greater heights in the future, and we will all be witness to it. Laparoscopic surgery has been a revolution in the field of surgery. It has benefited millions of patients all around the world and in our rural as well as urban setup in India. I hope you enjoyed this video and got a lot of information about laparoscopic or minimal access surgery. Do remember to like and subscribe to the channel. Thank you.